Were there any like strong client wins this week that you had with any of your guys?
I had this lovely lady. At the moment, she trained with me 3 times a week. When she came, she was not confident or comfortable in the gym. She had talked to a doctor about she knee replacement because her knee was so much in pain. She was just too young. She's in mid 40s, start 40s. So it's way too early to get a knee replacement. Or she think that I think that too as well. Over a period of time of a year and a half, we go from A to B, and it's been a long journey. She lost roughly 18 kilo. She's pain-free in her knees. Occasionally, they comes back when sometimes comes back. However, now she can walk stairs. She can walk downstairs. She could do lunges. And in the past, she said to me, I don't do lunges. I will take the elevator. And now, like day to day, she do not realize, but when we stop up and thinking back, or she do the stairs, she literally is so emotional, and she's like, oh my God, I literally had changed my life. I didn't think exercising and training could be so fulfilling and medicine in terms of enhancing your life. And she's just a lovely lady now on a journey going forward. And every week we are literally just progressing. And sometimes she's like, oh yeah, I don't think I've progressed so much. But then I'm like, okay, think about what we've done today and what we did a month ago, and is miles ahead. I've got her recently to do a overhead box squat, not because nobody really needs to do that, but just her form got better when she brings something over the head, because that forces her to keep her chest high. So when she's squatting low, she have a better form with something over her head. But now, because of more weight, I give her over her head where still she can still be in control. Suddenly, yeah, she's more stable. We progress it nice and slowly. And now she's doing 15 and 17 kilo overhead squats to a box or bench are quite low.
Wow.
And one time, like we got up with like 1 or 2 kilo, and she get really frustrated she couldn't do it. And then at one point I was like, just put it in, take your time, just breathe. And you can see she get really frustrated. And then I just have a conversation with her about something else. What are you doing the rest of the week? Basically just trying to get her out of the negative thoughts. And then after we had that small conversation, maybe a minute and a half, I'm like, do you know what I have right now? You just, like, you got frustrated. And if you don't try to change your mindset quickly, you'll not get it, because you get frustrated, you rush it. Like, we both know you had the strength, you had the flexibility, but you're rushing it. Slow it down, and you have it. And she did it. You could see her face, how her impression is like, yes. I even celebration behind it. So that's a one big win.
Yeah, okay, let's just like recap that. That's pretty amazing. So 18 months, right?
18 months.
18 months, came in, got a doctor's diagnosis that she would need a knee replacement. She didn't want to do that, you didn't want to do that, and you guys got to work, started training. She lost 18 kilos. That's insane, right? It's a massive weight loss straight off the bat. That's a huge win. And she's gradually been able to restore her confidence in moving through the knee to the point now where you guys are even doing overhead squats, which, for context of anyone listening right now, that's like so far up the continuum of difficulty as far as mobility is concerned in a squat movement. Like, probably right at the top of the most difficult movement that you can do in a squat pattern. And that's actually like quite a short space of time when we're talking about knee injuries like that as well. And she's in her early to mid 40s. So, nowhere near the age of like needing to be tapping out or having these kind of issues. So I was like, that's actually a very, very impressive story. I want to unpack that a little bit more in terms of what did that exactly start out like, in terms of what exercises did you guys like start with, and why?
We started, like, initially, I wanted to find out what did she like to do, what did she not like to do, and what can she do mobility wise. So initially I found a box, okay, to sit down and stand up, and then we progressed that into put a TX, and then I wanted to go as low as she could without any pain in her knee, and then slowly increase the range of motion in her knees, and for her to get more and more comfortable with that. That was where we started. We started with no with no lunges, with no crazy stuff. It was literally start from a clean camera. What can you do? This is our benchmark, and then slowly progressing. And that was basically what I did all the way around. And then this is here where we are. Anytime if she feels uncomfortable, out of breath, dizzy, no problem. Have a rest, sit down, have some water. She really liked balance exercises, unboostable or one leg stuff. She liked to do mobility stuff, stretching. Not because I do too much stretching, because I feel the return on investment, is return of the time you put into it, the strength work and mobility work in terms of push your range of motion were much more beneficial. But it was initially twice a week for a period of time where we slowly just have to build it. And when I think back now, it was with, sometimes not even with weight, sometimes with lightweight, and week in and week out, month in month out, it had been progressed. And where we actually both agree where the biggest achievement had been was she had a surgery at one point for a different issue she had, and after the surgery she was not able to train for 6 to 8 weeks. And it would have been so easy for her to just be like, oh, that's it, call it a day, I lost some weight, knees less in pain, it's going to be hard to come back. But she actually came back into 3 times a week, and we started back down low. Okay, what are you able to do now when you haven't moved for 6 to 8 weeks, and slowly built it back up? And now we are literally like, it's fun to think back for where it was, but because it was body weight, TX squats, and the knee flexion was just above 90 degrees. So for some of you that don't understand that, is you go in, this is her squatting, and she will go to this position and then back up, where now I get to overhead squat where her knee comes down in this position. So obviously it's greater than the 90 degrees. So I'm like, it's just a completely different woman I see, even when she walking to the gym or away from the gym. Even the confidence she walk with, she taught me herself, is completely different. So I'm buzzing, and it's only a year and a half we've been working. So yeah.
That's amazing, and it's always really inspiring.
Yeah.
Even feel like, when you're the trainer and it's not you that's technically going through that journey, so you're watching somebody else go through that journey. It's always really inspiring to watch that person's journey. It's always a massive privilege to be part of it as well. And yeah, like not just the physical transformation, but the transformation in who that person is, and where they go from being in a really like low place where they don't feel very hopeful, to like being like completely amazed by their own achievement, and to feeling like, okay, actually I can do more and I can keep going. It's always like one of the most rewarding parts of like working with people and going through that process with them. And yeah, like neither like yeah, everyone and their mother at some point has some sort of like, I'm sitting here with a knee issue myself.
Yeah, I
You've
do as
recently
well.
gone through, you had knee surgery a couple of years back. Like even myself, I think one of my recent wins was a client who basically had a meniscus tear from playing football. And so he's been like getting stronger, getting fitter, getting faster, like for the last couple of years now. Got to a really, really, really good level, like heavy deadlifts, heavy squats, heavy bench, gaining muscle, getting faster in longer distances. And obviously football was going well as well. And then bang, knee injury, and he goes for a scan. They tell him, he's got a meniscus tear. So I was like, okay, this is like, and obviously it kind of was very deflating at the time, because he's just been on the up consistently for a long time now. And it's like, okay, great. This is now someone I don't have that much physical contact with. And a lot of it, I've got to kind of guide this through this process through like WhatsApp and, the training app and all this other kind of stuff. And I'm just like, part of me is this, I don't have that much control over this situation. And so what's really remarkable for me with this individual is part of the reason why we were progressing so much in the first place is because he's so consistent and has just got such a good mindset and such a good attitude towards everything that he does. And he just he's consistent with following the plan. He engages when it comes to giving feedback. And so the communication with him is so high. And that makes the biggest difference when you're working with someone, and how open they are to communicating with you, how willing they are to have conversations with you, and how much you can unpack with them, versus people that don't tell you everything and don't engage with you as much and don't give you as much information. And so it's a lot harder to make smart decisions with them. But in this individual's case, because the communication was so good, I was getting so much information. I was getting regular feedback. I could message him after every training session, and he would tell me exactly how it went, how his knee felt, what were the factors in and around his day, whether he'd slept well, what was going on that day. He'd learned what I was looking for in terms of like nutrition, stress, hydration, and so he was factoring those things in as he was feeding back to me as well. And so he was a really great individual to work with. And then within the space of 5 months, we are back to deadlifting heavy. We're back to squatting at a medium high level, and we're back to running, which was the huge one. And we took it phase by phase.
Yeah.
Again, graded exposure. Let's just see what you can kind of tolerate. And then even then, I'm looking to like, here's what I think you can tolerate, and here's where I'm going to go in at, just as a cautionary thing of like, I don't actually want to test the maximum. I just want to see. I reckon you're around there, so let me go here. And we were always kind of working maybe 1 or 2 weeks behind where I thought he was potentially actually at, and he was happy to work at that pace. And that was like back in February. This is August now, and we're back to he was squatting about 115 kilos. We're back to 105. Not that I recommend anyone like rushing this. Like for context, he's mid-30s. He has got a long training history, very strong, very athletic, and I wouldn't necessarily say that what's happened with him is representative of what can happen with anyone. This is a really good story where it's a very successful outcome from an injury, but I don't want to go around saying like anyone can recover and get back to heavy squatting and running in 5 months.
Right.
Like I think that's unrealistic. This is just like a really, really, really good example of how it went. And again, I'm going to put it down to like how well he was able to communicate with me, and that allowed me to make those tiny little subtle adjustments to his training program. And then just the constant communication and the feedback and that sort of working relationship that we had. And, he felt supported, and he was super, super like thankful for the sport. And he's obviously super, super thankful that it's not ended up being like something that completely took him out. And, we're back to a 5 minute per kilometer running pace at 10 kilometers.
Well done.
So, and he's a little bit faster than that at peak. So we're probably a good 90% back in terms of performance. And when it comes to running, he wants to do another 10K race in September or October, I think. I can't remember exactly when. So we'll start training for that. And yeah, it was pretty cool because he'd signed up for a 10K in July, probably back in January. The injury happened. At that point, he's like, there's no way I'm making that 10K in July. And the fact that he then ended up getting to run that 10K in July and getting the 50-minute time on the 10K as well, it was just such a big moment because it was like, I never thought that this was going to happen. And to watch it, again, it is an unusual recovery rate for that injury. So I was just like, wow, you're literally like Wolverine, man.